What actually determines whether a rhinoplasty looks natural or fake? This is one of the most important conversations I have with patients before surgery. I'm Dr. Tatiana Luna, a board-certified plastic surgeon specializing in structural facial surgery and ultrasonic rhinoplasty. And natural outcomes are always the result of structural planning. Aesthetic balance begins with an arrow. So the nose sits in the center of the face. Its projection, dorsal height, and tip position influences the profile balance, facial proportions, and expression. Since it occupies such a central position, even a millimetric change influences overall harmony. That is why rhinoplasty requires architectural thinking. A natural rhinoplasty result depends on preserving and refining structural support in harmony with overall facial proportions. So we need to start by the basics. The nose has several structures that need to be supported and reshaped in order to give a natural shape to the nose. So we start with the septum. So the nasal septum is the base of everything. It provides central stability and alineation of the nose. The second structure is the dorsum of the nose, and it's composed of bone and cartilage. We correct the nasal hump to give a little more harmony and structure to the nose, but also the nasal sidewalls have to be corrected, and for this we use the ultrasound image. This will help me carve the bones in a more precise way with less swelling and more natural and structural results. Third, we go to the tip. And the tip is composed of the lower lateral cartilages, but it's also very influenced by the characteristics of the skin. So I have to reshape them, do some sutures, some cuts, and also give support with some cartilage grafts in order to give it a more harmonious shape that will stay that way throughout time. So a natural rhinoplasty is determined by structural integrity combined with an acute sense of proportion and beauty. Everything should be planned in an individualized manner, and that way you have the perfect nose for each face in every case. If you're considering rhinoplasty and would like to understand how structural evaluation applies to your case, don't hesitate to reach out or leave your questions in the comments below.